Good afternoon, everyone. I am going to talk a little bit about our measles outbreak within the city of Waterville, Virginia. Very, very important. We've been experiencing such an outbreak within our community. This presentation will explore the measures taken to control the recent measles outbreak and protect our local community. And here is some of the timelines, just so that you can get a little bit more reference to what we're dealing with within the city of Waterville, Virginia. March 1st, we had our first case of measles reported in the town. March 10th, 2023, we had 5 additional cases. March 15th, we opened up vaccination clinics in schools and community centers. March 20th, we had a total of 15 confirmed cases, all linked to the initial case of March 1st, 2023. And April 1st, 30 days later, we are happy to report that there were no new cases and that the outbreak appears to be contained at this particular moment. Now, what is measles? Measles is highly contagious viral disease caused by the measles virus, a member of the family. Symptoms: fever, cough, runny nose, red eyes, and a characteristic red rash that spreads the face to the rest of the body. Complications: potential complications include pneumonia, edema, brain inflammation, and even death, especially in young children and individuals with weakened immune systems. Why is measles so devastatingly impactful now? It's been around a long time. Measles is a serious and potential life-threatening disease that can be prevented through vaccinations. Early recognition of symptoms and prompt medical care are crucial in managing the viral infection. Just to give you some of the causes for the outbreak, we have to deal with low vaccination rates, that once again, parents are immunizing their kids, international travel, lack of herd immunity, misinformation about vaccines. That's what we're currently dealing with today. Accessibility barriers, limited access to healthcare service and vaccination clinics, particularly in underserved and marginalized communities, and waning immunity. In some cases, the immunity gained from previous measles vaccinations or infections may have waned over time, leaving individuals susceptible to reinfection. How does this all impact our community? The outbreak has had significant impact on our local healthcare system, straining resources and personnel. Hospitals have been overwhelmed with a surge of patients, leading to delays in care and a shortage of critical medical supplies. Local schools have been forced to close, disrupting the education of students and placing a heavy burden on our families. Businesses, especially small and large enterprises, have suffered significantly financial losses due to lockdowns and reduced consumer spending, leading to job losses and economic hardship for many of our communities. Just to give you some context in terms of what we deal with current vaccination coverage within the town compared to the recommended levels. 93% measles, influenza, 78%, 87 hepatitis, 95 recommended herd immunity levels. Steps taken to control the outbreak. We did vaccination drives. I think that was really, really important. Local authorities and providers organized large-scale vaccinations campaigns all throughout the city. We did public awareness campaign with our local health department. Extensive public awareness campaigns were launched, utilizing various media channels to educate our public on preventative measures such as social distancing, mask wearing, and proper hygiene protocol. Contact tracing. Robust contact tracing efforts were implemented where healthcare teams worked to identify and isolate individuals within our health department, temporary lockdowns within our community centers, our schools, our local businesses, and we definitely did increase testing and monitoring all throughout the cities. We had testing sites in schools, community centers, businesses, recreation centers, all of those above. Here's some of our community response and resilience. Neighborhood watch coordinators, we use volunteer coordinators, local business owners, retired nurse volunteers, as well as student council president at the local high school. Some of our lessons learned and looking ahead, importance of public-private collaboration. We also did enhancing emergency communication strategies, stockpiling critical supplies and equipment, really making sure we had enough inventory for our medical personnel to give out the vaccinations, strengthening surge capacity in healthcare systems, expanding healthcare systems capacity to handle increased patient volumes, increasing staffing, facilities, and equipment. And last but not least, integrated technology innovations, which means expanding our telemedicine, contact tracing, looking at data analytics to enhance disease surveillance, case management, and community engagement. These were some of the brief highlights we rolled out in our communication strategy to make the city of Waterville much safer because of the measles outbreak. You take care. Bye-bye.